So good afternoon, everyone. My name is Mārtiņš Vargulis. I am Director at the Analytics and Advisory Group PowerHouse Latvia, and I'm delighted to be accompanied with the author of the Healthcare Readiness Index 2024, Martin Smatana, who is researcher at the GLOBSEC, and GLOBSEC, as the organization, is kind of the behind the closed doors in having an idea and then delivering that. So, Martin, pleasure to speak with you. And this is a follow-up discussion to the panel discussion that we had online a couple of days ago. I wanted, with this discussion or conversation, because we also did one of the research health economics barometer when we wanted to understand how the uninvestments is directly linked to our competitiveness when it comes to the business, when it comes to the economy on global stage. So it's not that just financially you are looking how much you contribute, what are the expenses for the healthcare system, but you look from the perspective of the investment, right? And there are a couple of correlations how you can analyze that. We are significantly unfunded when it comes to the health, and that is something that you also figure out in the index. Can I start with why Healthcare Readiness Index and why it's so important for GLOBSEC as well?
Yes, so good afternoon, and thank you for actually inviting me. It's our pleasure to be here today. So as you introduced us, so the GLOBSEC is a think tank which originally was based in Bratislava, then expanded into basically the world, from Ukraine up to Washington. And yes, originally we did not focus on healthcare, but it changed in 2022 when COVID-19 pandemic struck, because unfortunately all of us could see with our own eyes that if a healthcare system fails, everything in the country collapses, because the shops are closed, the schools are closed, the economy crumbles. So the healthcare actually clearly proved that if it doesn't work, if it's not efficient, it is of security and resilience risk. So for this reason, we wanted to have a look at GLOBSEC at what made some countries more successful than the rest at dealing with COVID-related issues, because some countries, even though they had several like large percentage of people infected, they didn't suffer as much as some other countries. But while we were working on this comparative analysis, we realized that even though most countries had not yet recovered from the COVID-related problems, most countries are soon to face another set of challenges which are more silent and therefore often off radar to politicians, such as rise in non-communicable diseases and aging. And the tricky bit about NCDs and aging is that since they are overlooked, they are silent, once they struck, it's too late to act. So we wanted to make sure that this does not happen, that politicians, decision makers do not they don't disregard healthcare because the COVID was over. We wanted to remind them that if we want to be ready for these future challenges, now it is time to do the reforms. Now it is time to invest. Now it is time to educate people. Now it is time to actually change the system so we are ready when the situation comes. And sorry, one last thing, and this is especially true regarding the war on Ukraine, because the reason why healthcare systems in Europe work as they work, that they are compulsory for everybody, is that originally they started so that the population is healthy, so they are ready to work and defend in the case there is a problem. So now it is time to build resilient healthcare system, so we are ready and prepared.
What would you say when it comes to the main trends? I'm not saying even the main conclusions, but meaning main trends. You started that in 2022, right? And it's already dynamics. You can go back and see how countries are evolving. And 2022 was year after the COVID, but then the war in Ukraine, Russia's aggression in Ukraine started. What would you say from the broader perspective, from the European landscape perspective? What are the trends when you look for the healthcare readiness?
So I don't think there are any positives to COVID, but this one, and it is that it really made politicians realize that healthcare is important. So during 2022, 2023, basically all countries, especially in CE, or 21 to 2023, significantly increased level of finances in the sector. unfortunately, I will talk about it probably later on, only temporarily in many cases. Many of these countries managed to implement reforms which were not possible before because they felt pressure, so they did something which was not popular but had to be done. In many cases, they restructured hospital networks or introduced a reform to outpatient providers, which to some extent in some regions might have caused some problems, but on overall macro picture and over medium to long term will bring more value than potential damages and issues with access. So these were the trends which we could observe up till 2024. And in this year's index, because it is called Readiness Index 2024, because most of the data is from 2024, even though we published it a couple of days ago. Now we could see that many countries are shifting their interest and resources and finances to other sectors. And it can be seen already, unfortunately, also when it comes to, for example, Latvia. We've gone through a nice diagram which showed that as you had nice spike in increases in 2021, which then was slightly reduced, which is a shame, because if you continue the same rate, the situation would be different today. And if you continue for many years, because health expenditure and spending is a marathon, not as a sprint. But these trends that countries shifted interest elsewhere, you can observe all across Europe, but there are some exceptions such as Poland and Romania. And even though these countries are in our index currently not very well placed, they are the second and third least ready, I believe that in coming years they will rise in our index and they will be better than Latvia, Slovakia, which means that we will decline in our rankings.
Well, a couple of points. I think that the percentage of increase comparing to other countries, for instance, you said that Latvia was one of the leading during the COVID, but on the other side, that also illustrated that we were not so much ready. So we needed to respond to such a crisis. We needed to invest more than other countries, especially, for instance, Sweden, right? That was, and I understand that is one of the health when it comes to the healthcare readiness, is the top one, top two, top three country. On other point, exactly what we also witnessed during our barometer was we were also doing the survey. What do you perceive? What are the main priorities right now, even in the current geopolitical situation that we are living? As a frontline stand, when we understand what kind of neighbor we are dealing with, health was number one. And not only that, there was security. Even before that was economic situation. So basically, people understand, society understand that the health is an important element. Looking through the methodological part of your index, there is list of 100 indicators, right, that you are taking or going through. From your perspective, what would be the most crucial, if I may say so? Of course, every of activity leads to overall readiness or overall resilience, but and also coming a bit to Latvia, what would you say? What is the most important indicators we have to look up for in following years?
That's a very, very tough question, because the biggest issue, there are two biggest concerns I have regarding Latvia's healthcare, which is level financing and the human resources, which is something that we discussed at length. And there is the third one, which I also touched, which is the leadership stability, which is very, very important. And I showed a nice diagram which shows how it visually nicely correlates. The longer is there is average tenure of a minister, the better the results of index, because the longer a minister stays in his or her office, the more time they have to actually implement reform, build value, or implement reform and then fix the issues of the reforms, because in most cases the reforms are implemented with problems and issues. And this is something which we can't easily influence, but is of extreme importance. And that's why I'm very happy that I can be here today and actually you do your work, because in most cases in the CE region, these countries have been struggling with poor tenure of ministers. So there are countries which change ministers of health every year or every year and a half. Romania, for example, Slovakia, that's average tenure is 17 months. And the most successful cases when it comes to a reform projects or large-scale project is if it was led by an external party, so an association or important stakeholder or NGO that communicates, has clear vision, transparent, and drives the changes, disregarding who the minister is at the period of time. And this is very, very important to keep the continuity, stability, to drive long-term value, not only focusing on the the short-term fires that needs to be put out.
Is it only about the money?
No.
Or is there anything that you can also see, taking into account and analyzing those countries? You can see that, well, this is the story of efficiency, or this is the story of affordability, or something else, but within the context of already existing limited resources.
Yes, it's of course not only about the money, it's about how the money is actually spent. But that is the problem. When we look into the best-in-class countries, Norway or Sweden, you would look into, for example, OECD with IHME, the Institute for Healthcare Metrics and Evaluation. They published a nice report stating of how many or what percentage of disease can be attributed to different determinants of health, such as the diet, risk factors, and tobacco, smoking, etc., etc. You would see that these countries are significantly below average because for years they have invested into making sure that the youth do not consume alcohol, do not smoke as much, they have a better diet, etc. These factors are absolutely critical in making sure that the readiness tomorrow, which means the demand for services, will be more manageable, but it takes time. That's the problem. In most cases, the most efficient activities takes time to see the results, and that is the problem why they are often overlooked in the CE region, because if the ministry changes every year and a half, in many cases, he or she spends so much time on something that the value will be brought in next, well, maybe even generation. And that's the biggest advantage of these countries, that they have been focusing and building them processes, infrastructure, resources around the concept of improving public health. So they actually are seeing the results now. And that's the biggest advantage they have, which is something that we will need years to actually see the results of, which is unfortunate. But if we start today, it will come in coming years.
But still, what are the main missing parts for Latvia? What would you say? I hear what you were saying regarding the continuation of the minister, he or she, understanding the political system that we are living in, of course, and especially in the healthcare system. I think it is important when we are speaking about the reforms, it takes years, right? To start to think about that, properly communicate with the main stakeholders, and then implement that, and then monitor how the implementation is going on. One of the main reforms that were done by this minister currently is regarding the pharmaceutical sector, right? But it took some years, and it's still, I would say, ongoing. Although the feeling is that it's already done. You have to monitor that. But other than that, what would you say? Bit out of box, also thinking and looking at Latvia. What would be your kind of suggestions? What we have to develop
to improve the results,
yes,
right? And improve overall or readiness today, tomorrow.
Yes, exactly. Today and tomorrow.
Yes, although, sorry, today is very difficult to influence because it's already the consequence of previous actions. Maybe just one more word about the readiness today bit. Maybe we have to just mention that unfortunately in here, Latvia is really struggling. It's the third lowest when it comes to the overall results of readiness tomorrow, especially due to the life expectancy and avoidable mortality, which really unfortunately causing Latvia has a very poor starting position in the long run. And regarding readiness tomorrow and some factors which it can influence, the question is to what extent we'll have access to resources, because the access to innovation which will deliver value will require finances. The processes when it comes to the access to medicines are not bad, but they are restricted to a level of resources that you have. You already have a fairly good access to diagnostic equipment, CTs, MRIs, but you have issues with HR which can't be solved quickly. There are possibilities to adopt the AI automated tools with some limitations regarding the existing EU level legislation on their usage on patients. So in here we also will have to wait a couple of years so they can be used on large scale basis. Regarding other factors, there are some opportunities regarding, for example, vaccination rates, where still, even though in some cases, such as the HPV vaccination is not, Latvia is fairly good and comparable to the rest rest of the Baltics. But when it comes to, for example, influenza and some other type of diseases, there is still room for improvement, which will deliver value, especially for elderly and the people who are actually at risk from these type of diseases. But I don't think there is a very short solution that would help you to jump the rankings. And that's the problem. That's the reason why I was so stressing that the best-in-class countries tend to perceive healthcare expenditure as an investment, not as a cost. And that's why I stress so much. It's about marathon, because there are no quick solutions. There are no quick win-wins which could be applied that you would be able to do without your neighbors doing the same and eventually actually copying them from you. For example, regarding the HR, you could raise wages, you could make changes, but they could copy it, and then you wouldn't see it as much as different, which was the situation in Slovakia when we raised the wages of nurses and doctors, and Czechs did the same, and since their economy is better, they could actually raise even more the wages. So unfortunately, I don't see any quick solution.
There is no silver bullet, right? It's
No, that's the point. The stability, continuity, investment, that's the only way that seems to work.
And what are the risks then? I mean, if we are not investing, if we are not properly taking that, if we are not investing those activities that is properly mentioned here, what would you say? How opponent could use that? How the health sector could be used from the military perspective?
Can you use from military?
I mean, military in times of crisis. How that is it somehow helpful also for aggressor in this regard?
I mean, for sure, because that's the reason why we do this index, to show that if the healthcare system does not work, the people are not as healthy as they could be, which we can see when it comes to life expectancy, or even indicator of healthy life years, which is actually very poor, which is always an advantage to a potential aggressor, because they know that the capability of a nation to defend itself and to be able to care for wounded is very limited, which is the reason why several other countries in the CE region are actually using resources from Ministry of Defense to expand on civilian infrastructure, bridges, roads, even hospitals such as Slovakia, which Ministry of Defense is reconstructing and building to be prepared in the case of whatever type of emergency comes in the future. So yes, for sure. In our presentation and the index, we have one diagram graph we went at look at, which is the one which shows the healthy and non-healthy aging scenario, which also clearly shows what can happen if you improve, for example, your determinants of health, the consumption of fruits, smoking using tobacco products. And that's actually one of the highlights for me of the findings, because Latvia is the country which has the highest potential to actually improve the future level of finances in relation to today's values, if it manages its determinants of health better. And actually, it is the country with the highest potential to actually reduce finances as a percentage of GDP. So in the future, it will rise, but as a percentage of the GDP, it has potential to decline by actually 11%, according to the aging report by EU Commission, which is amazing, because this is something that most countries can't achieve, whatever do. There are some countries which, in non-healthy aging, they will grow by 40%, in healthy 20%. But you can actually reduce by 11%, as long as you do it. And the reason for this is that, comparable to other countries, especially in CE, your demographics is not as bad as some other countries. So you can still build on it, but for sure you need to improve the behavioral determinants of health, which are driving the unnecessary health demands to excessive number.
Oh, perfect. Thank you, Martin. Where we can find it? I mean, how can we
yes, you can. You mean the study?
Yes.
Oh, yes. You can find it on the GLOBSEC webpage. You will be able to find it in the publications list there. You will be able to find also the previous editions. And also last year we did a disease-specific study on neurodegenerative diseases in the CE region, because it seems to be a specific problem which is not very well treated in our region, because that has not been a concern for many countries. So it's like especially overlooked type of group of diseases. And also we have other studies which are focusing on determinants of health. So we have a nice big study on alcohol, on diet risks, also on smoking, doing like the cross-country comparison, etc. So if you're interested in nice graphs, reading numbers, so it's all available there.
I'm definitely that viewers and listeners for this podcast is definitely looking for that. Thank you very much for your report, for your time, and also illustrating what are the way aheads for Latvia comparing to any other. So there are out there already some of the solutions that we can take and implement here in Latvia, and understand that healthcare system is part of overall comprehensive state defense system. So thank you very much. For viewers, listeners, stay tuned for the next episode of this podcast series. Thank you.